An awful lot to get through. Let's get straight to it. Let's go straight to the announcement you are making today. More support for schools and students as Plan B comes to an end. It's support for vaccinations, though. Since when are schools about vaccination, not education?
Well, they're very much about education, and I want to thank all those listening today, head teachers, teachers, support staff, for everything they've done. 99.9% of schools are open. What this is today is £8 million from NHS England to help support the admin and the time any teacher takes to make sure that we continue the drive to vaccinate 12 to 15-year-olds. We're at 1.5 million now who've had at least one dose. They're now eligible for their second dose. And of course, 16 to 17-year-olds can get their booster jab. So this 8 million is just additional support to schools, £1,000 for each eligible secondary school, special school, or alternative provision,
Um,
to make sure we continue on our fantastic journey of vaccination.
Well,
As
vaccinating people your and my age, Mrs. Howie, and older, all very sensible. But
mm,
given that, like pretty much every other 15-year-old in the country, my daughter has had COVID already, twice in fact, and is at virtually zero risk as a healthy child, and the children at risk have already been eligible for some time. Why on earth are we prioritising this? Why don't we prioritise making sure we get jabs into those people who, on a completely voluntary basis, those who have not been jabbed, who are at risk, rather than
we're
kids
doing
who aren't?
we're doing both, Julia. That's the great thing about the vaccination program. It's been one of the most successful in the world. From the first time, I got the phone call from the PM to say, "Will you lead the vaccination deployment?" All the way through, the team has delivered. I think the most successful peacetime deployment in the history of this country, and they are to be commended for it.
I,
And we
I,
continue to do both
I
things. There's,
agree
there's,
with
there's not a trade off.
I totally agree with you on that. It has been amazing success, and you were very much a part of that. But again, an awful lot of people, the fact that only 15% of 12 to 15-year-olds in this country have been jabbed tells you that apparently, parents are voting with their feet there, aren't they? Let's talk though about who else gets jabs. Mandatory jabs in the NHS. As of in a week's time, people are going to be starting to get their notice period to leave the NHS and lose their job as of the 1st of April if they have not had their double jab. Lots of reports over the weekend that this was a policy that, the Royal College of Nurses, the British Medical Association, the Royal College of GPs, all oppose, say this is crazy, we're going to lose, tens of thousands of valuable staff, ICU consultants like Dr. Steve James, who we're going to talk to again later in the show, hospital porters, and we can't afford to lose these people. Is it true that this policy is going to be paused?
Well, look, I think if you're looking after the most vulnerable people who are coming into hospital, you have a duty of care to make sure that you are protected, as well as, of course, protecting them against
But
infection.
lots of these people have already had COVID. They were on the front line. We were clapping for them
I
this
hear
time
you.
a couple of years ago.
And we continue to clap them. And over 9 in 10 of the 1.2 million full-time equivalents who work in the NHS have already had their vaccine since the announcement of the mandatory vaccination. I think initially it was about 100,000 left to get their vaccine, and it's now down to 70,000. So people are coming forward. And by the way, there's precedent for this because if you're a surgeon, for example, you can't practice surgery unless you are vaccinated against hepatitis. So I think people have a duty of care when you're looking after the most vulnerable to make sure that when they come into hospital, they don't, are
No.
exposed to an
But,
infection of
but
COVID.
but but people can still be exposed to infection from COVID, as you know. I'm just recovering from COVID right now. I'm double jabbed. There's a
Mm,
Keir Karma, treble jabbed. He had COVID and was isolating for some time. You know perfectly well as I do that you can still
mm,
very easily catch COVID, certainly
mm.
Omicron, and you can pass it on to other people, even if you've been double jabbed. So that doesn't resolve the issue. And indeed, many of the staff right now who are not jabbed, who have had COVID in the past, have been busy working, covering the shifts in the NHS for staff who have been treble jabbed, who are off with COVID right now.
Well, I can tell you that, both as the vaccine deployment minister at the time, talking to the NHS, and, as I say, I think we're at 94% of NHS staff, frontline staff, vaccinated, and that's really
Yes.
an excellent, number, but we can build on that further. Why? Because it's important. Because I think people have a duty of care for the most vulnerable. 90% of those in ICU have not been vaccinated, and I think it's important that we make sure we get those who work on the front line, who protect the most vulnerable, to be themselves protected, and I think that's the right thing to do.
Except they've already had COVID, but there we are. Let's also talk about Crunch Week for the Prime Minister this week. Number 10 police have been questioned by Sue Gray over her investigation. The report is due, we expect, Wednesday or Thursday this week, unless, of course, we have some more parties to investigate. We seem to have had a few more every week. We're now looking at parties possibly in Boris Johnson's own personal flat above number 11, held by his wife, Carrie Johnson. We've heard the police officers, their evidence has been so damning. One quote from the front of the Telegraph today: "Put it this way, if Boris Johnson is still Prime Minister by the end of the week, I'd be very surprised." Would you be surprised if the Prime Minister is still in his job at the end of this week?
Well, as the Prime Minister says, as I've said on your programme many times, that Sue Gray will be able to go wherever her inquiry needs to take her. Her terms of reference are clear, that she can go wherever she needs, the evidence takes her. And of course, the findings will be made public. That's the terms of reference of her inquiry, and I would rather wait for that than rely on a quote in the media. And I think the important thing to remember, Julia, and you will, I hope, appreciate this, that the PM on the big calls, whether it was on vaccines initially. By the way, I'll tell you a very small story. When we presented the PM with the opportunity to buy 60 million doses of Pfizer-BioNTech. This is way before Omicron came along. We were still in the first phase of vaccination. And some advisors were saying, don't buy it. He turned around and said, no, we need to have that additional insurance just in case there's another variant. And what happened? There was a variant. We wouldn't have a booster campaign today if it wasn't for this Prime Minister. We certainly would have been locked down if it was left to Keir Starmer before Christmas, or at least gone further with lockdowns, as Wales did and Scotland did. And this Prime Minister actually looked at the data and said, no, we stick to Plan B, which allowed us to be the most open economy in Europe, which I know you applaud. I know you care about business, especially small business. So on the big calls, this Prime Minister got it right. He's human. He made a mistake. He came to Parliament, apologised. We've had the apology. Now we need the detail, and he has pledged to come back to make a statement when the Sue Gray report.
Many would say a non-apology. I must ask you just finally about Nusrat Ghani, the former Transport Minister. She claims that she was told it's her Muslimness that was a problem. She claims that a whip, now later identified as the chief whip, Mark Spencer, has said this to her. He has denied this. Just to let you know, a statement from number 10 in the last couple of moments. The Prime Minister has asked the Cabinet Office to conduct an inquiry into the allegations made by Nusrat Ghani. At the time his allegations were first made, the Prime Minister recommended to her. She made a formal complaint to CCHQ, Tory Central Office. She did not take up that offer. The Prime Minister has now asked officials to establish the facts about what happened. As he said at the time, the Prime Minister takes these claims very seriously. Do you think it's right there should be a full investigation?
Absolutely. She's a valued colleague and she's made a very serious allegation. And to be fair to her, last night she made a statement saying it may even be people who weren't members of the Conservative Party who may have said this. You've just mentioned the Chief Whip, who I work very closely with, has categorically denied this. Is only right that the Cabinet Office look at this.
So who do you believe? Because one of them's lying, aren't they? I mean, they can't. Nusrat Ghani and Mark Spencer can't both be telling the truth.
I am not going to impugn the reputation of my close colleagues. We are, a team, and we, work together as a team. Both, I was a backbencher for 8 years, and I know how effective Nus Ghani's been as a backbencher. She was an effective minister as well. She's a valued colleague, which is why I think she should be supported. But actually, we need as the Prime Minister has spoken to Nus last night, has said that the Cabinet Office will look at this properly. That's the right way to go about this.
Have you experienced any issues because of your background?
No, I haven't. On the contrary, as you've noticed, I've gone from a backbencher to a Secretary of State for Education, and I'm very proud to be part of that team that is delivering for this country.
Thank you very much for joining us, Nadhim Zahawi. I know you've got another interview to get to. Education Secretary Nadhim Zahawi.